good afternoon, and welcome everyone to our webinar this afternoon that's focused on keeping pace with what at times might seem like an avalanche of research literature. My name is Deb Hill, and I manage our project to enhance research literacy here at the Academic Collaborative for Integrative Health. I wanted to go through a couple of housekeeping items up front. All attendees are in listen-only mode to help us control the background noise. And we will be taking questions, and those can be typed into your GoToWebinar control panel. And our speakers will answer as many as possible towards the end of our discussion today. But do feel free to put those in there and type in those questions whenever you have the opportunity to do so. Also, today's slides are in the handout section of your control panel, and you can feel free to download those. They will be available and posted to our website also at a later date. So I wanted to go ahead here, sorry, just a little bit of housekeeping up front here on my end. Wanted to go ahead and have Jennifer go on to the next slide deck here, the next slide. I wanted to introduce, start off with a very brief overview of our organization for those that might not be familiar with the Academic Collaborative for Integrative Health. And for those that are, you will note that we recently changed our name. We were formerly known as an Academic Consortium for Complementary and Alternative Healthcare. But in short, we are a broad multidisciplinary organization, and we work to foster interprofessional collaborative healthcare that is inclusive of all health professions. And our core members are from 5 integrative health professions that you'll see there on your screen. And together then through our member organizations, we are linked to about 375,000 licensed integrative practitioners and about 180 accredited academic institutions and programs. And we really work to advance the values, practice, and disciplines associated with integrative health and medicine. Next slide. So today our webinar is sponsored by the Project to Enhance Research Literacy here at the Collaborative, which is partially funded through a generous grant through the Josiah Macy Jr. Foundation. And we really, today we wanted to provide an overview tour of resources that are largely freely available to help you stay on top of what can seem like a mountain of research literature. And so who better to help us than our experts in information literacy that are joining us today. And so first I want to go ahead and introduce Jane Saxton. Next slide. Welcome, Jane.
Hello.
Great to have you with us here this morning, I guess, for you on the West Coast, afternoon here in the East. Jane is the Director of Library Services at Bastyr University and has over 30 years of experience in academic and special libraries, 16 of them at Bastyr. She is committed to raising the level of research literacy in the complementary and integrative health fields and beyond. And Jane has developed multiple evidence-informed practice resources, served as a search coordinator and co-author on systematic reviews, and is currently collaborating on an integrated curriculum to ensure that students meet the information literacy competencies of the Naturopathic Medicine Clinical Doctorate Program. So welcome, Jane.
Thank you. Thank you, Deb.
And next I want to welcome Janet Tapper. Welcome,
Hello.
Janet. Great
Hello.
to have you here with us today.
Thank you.
Janet is the University Librarian at the University of Western States. She is a graduate of the School of Library and Information Management at Emporia State University. Janet is also a member of the ACRL Oregon Board of Directors, chair of the Chiropractic Library Collaboration, and convener of Medical Library Association Chiropractic Library Special Interest Group. She's also a founding member of the University of Western States Evidence-Informed Practice Curriculum Committee, and she regularly presents on information literacy topics at national and international library and healthcare conferences. Janet is also a duties core selector at the Chiropractic Specialty and frequent reviewer for Library Journal. So welcome, Janet.
Thank you.
Great. So today we have really 3 main areas that we're going to cover. We're going to start with some tips from our speakers on how to keep current with minimal time and financial investment. And then we're going to review some resources that you might not have been aware of in your local community. And we will finish with a review of how to keep all of those great resources that you found, all of your literature organized in one place. So I do want to take just a moment again to mention that the slides are freely downloadable from your GoToWebinar platform. And I know we're going to be presenting a lot of information today. That's why I want to mention at this point that the slides are available. All of the links in there should be active. If they're not, they're spelled out. So anything, hopefully you can sit back and listen and not worry about writing down all of the information and links as we go along with our presentation. So today, Jane is going to actually start us off today with set the stage for our journey. So Jane, I'll let you take it away.
Okay, thanks, Deb, and welcome to everyone. So let me begin by saying that descriptions of the growth of information have become increasingly alarmist for at least the last 20 years. We regularly get warnings that we're in danger. We can be crushed by information overload. We can drown in the sea of information. We can be swept away by the tidal wave of information. And even the phrase exponential information growth is alarming, well, given the nature of exponential. So as we know, the evidence-informed approach asks practitioners to identify the best evidence for individualized patient-centered care. This is often, but not always, research evidence. And how can a practitioner know they've identified the best evidence for their patient? That's what Keeping Up is all about. So today we plan to identify the important categories or types of Keeping Up tools, and then we want to highlight some of the best and brightest examples in each category. So this is the Bastyr Keeping Up with Clinical Research Guide. Everything on it is freely available. And this is the first web page of the guide. So it has these strategies, and this is an important thing to consider in Keeping Up. The strategies and tools that will keep you informed can also save you time. And I just want to say that as with patient-centered care, putting together a Keeping Up system that works for you is a highly individualized endeavor. And ultimately, your system might include only 2 or 3 of the tools we're going to go over today, but that can make all of the difference. So, next slide. This is the strategy 1, again, screenshot of our guide, which the URL is at the bottom of the page. This is MyNCBI tools. So PubMed's MyNCBI feature is definitely one of the most useful Keeping Up tools. And this page of our guide has all the information you need to register for a free MyNCBI account and to start using it. So let's talk about some of MyNCBI's fabulous features. And next slide. This is the PubMed home screen. And before I go to MyNCBI, I want to call your attention to the links on the left side in the red circle using PubMed. If you're not familiar with PubMed search features, so for example, using filters, the clinical queries filter that really is helpful for clinicians in limiting their searches. Exploring these links to learn the basics will be well worth your while. In the upper right, the other red circle is the link for registering for a MyNCBI account. So you go there, and then next screen. Next slide. This is the MyNCBI homepage. And as I mentioned, setting up a free MyNCBI account is easy. And our Keeping Up guide that we looked at 2 slides ago will walk you right through the process. Okay, but how will a MyNCBI account benefit me, you may be thinking. For one, and I think this is the great advantage of having your personal account, it allows you to save your search queries. So the first step is you spend some time up front carefully considering the search terms that best capture your topic of interest. And if I can put in a plug, consulting with a librarian at this point can be quite beneficial. And then you save this fabulous search in your MyNCBI account. And then you tell MyNCBI if and how often you'd like to be notified when new citations or topic are added to PubMed. So this essentially lets you move forward in time with your topic of interest. And if email is part of the whole too much information thing, as it is for most of us, You don't need to select any email alerts. You can just rerun the search. My NCBI provides a What's New search button that will show you the citations that have been added since the last time you ran that particular search. My NCBI also lets you specify various filters if you're interested in research after a particular date, or there are many other options under the filters section. And it also lets you select journals that you want to follow. And it will send you the latest citations from these journals that you select. Our Keeping Up guide, the MyNCBI page, has a description of how this very simple system works. And this feature is similar to receiving tables of contents from the journals you select, but the advantage is that it lets you select several or many journals all at the same time. The citations from the journals that you select appear as a PubMed search results list. So these would be the current articles appearing in the latest issue of the journals you select. And MyNCBI will send you a link to this. Later in the presentation, Janet's going to discuss another good way to receive tables of contents from journals you're interested in following, because not all journals are indexed in PubMed, and then the PubMed journal alert won't work for journals not indexed in PubMed. So let me just say the short videos on our Keeping Up guide will show you how incredibly easy it is to begin incorporating MyNCBI features into your Keeping Up strategy. You could also Google MyNCBI. The National Library of Medicine provides many how-to-use videos of their own as well. Deb?
Great. Thanks so much, Jane. That's wonderful. And I like how you recap there that you have the videos are freely available. Your live guide there from Bastir is a great resource for folks to get started. And also reviewing the MyNCBI account and how really a small investment in time can really pay off big down the road, a small investment up front. So next we wanted to go ahead and shift gears a little bit. And we're going to shift over to Janet, and she's going to cover some surprising local resources that you might want to check out to help yourself keep abreast of the literature. So Janet, I'll hand it over to you.
Thank you. Good morning. I did want to mention that my NCBI stands for My National Center for Biomedical Information. So now you know what those cryptic letters stand for. Academic libraries are a very interesting resource that you may have in your local community. This is any kind of a state library, state school, state university, or public university are often, and in fact usually, open to the public. So, and once you are inside the door, you become a public user and a patron. That means that you have access to all of subscriptions and all of their full text databases. You need to contact the circulation desk and ask for a public user account, but once you have that in your hands, then you can sit down and research to your heart's delight. Academic libraries often will well, they don't really differentiate between students, faculty, and the public in their reference services as well. So these places are excellent resources for the public to walk into and utilize. A lot of those resources are supported by your tax dollars, so feel free to walk in the door. Next slide, please. Another surprising resource are your public libraries. Depending on the funding of public libraries, they often have very strong resources in terms of full text databases. For instance, the Seattle Public Library, you can see on the top end of the right-hand column, they carry Natural Medicines, which is considered one of the finest evidence-based databases with monographs on alternative, complementary, and integrative therapies. This is an excellent resource that's available to you for the price of a public library card. and we all know that that is free, a very good price. They also carry a lot of the ProQuest resources and other types of databases that have full text. Public libraries also have interlibrary loan. This means that you can go to the library and request articles and books, and they will research those and get them for you. Typically, the articles will take a day or so to get the articles, and books can come from across the country if the book you're looking for is unique. That means whatever is out there, that library will get it for you. You pick it up at your local public library, read it, return it to your public library, and the librarians will do all the work for you and send the title back. Now, there are some libraries that will do this as a matter of service to their patrons. Sometimes there's a nominal fee for shipping. So it sort of depends on how well funded your local public library is, but it's certainly worth the time to go in and find out exactly what services they're offering. Next slide, please. So this is now the National Library of Medicine. We're kind of going back to the Library of Medicine, also supported by your tax dollars. They offer the Lonesome Doc program. The Lonesome Doc is interlibrary loan for individual doctors. This is a program that you sign up and identify various libraries. You can sign up with 4 libraries, and when you're on PubMed, you can order articles from them. The field doctors can sign up for 4 libraries, but you should contact those libraries prior to finding out what their policies are. Many libraries charge per article, although this will usually be less than publishers' costs. Alumni can usually get a better deal than random individuals, and so check with your alma mater to see if they do support the Lonesome Doc program. I should say that not all libraries do support Lonesome Doc. And what I mean by support, that means do they participate in the Lonesome Doc program. Understand that the Lonesome Doc program is part of the interlibrary loan system, and that it is subject to copyright restrictions. This means that you will not be able to order large quantities of articles from one particular journal, because if you do, that sort of identifies you as a subscriber, not a borrower. Also, articles sent to you through this program cannot be posted to social media. You can't make multiple copies to hand out at your weekend seminar or leave articles stacked in your waiting room for your patients. The articles are strictly for your personal clinical work and possibly to share with a colleague or two. The costs will vary. At our institution, we do support our alumni for free, so you should check with your with your alma mater to see if they also support the Lonesome Doc program. And there is quite a bit of information about how to sign up and how to use the Lonesome Doc and how to order the articles on the PubMed site. Next slide.
Oh, thanks, thanks, Janet. Actually, before we head on, I'm just going to take a little break and recap a couple of announcements here. Actually, we just got a comment in from Shannon Anton that today is International Midwives Day. So, congratulations for all the midwives that have joined us today. Also, I just wanted to recap a little bit about some of those resources. Just a little overview again: the academic libraries, your public libraries, and then the Lonesome Doc is all great services, and hopefully. For those of you that are on the line today, you have a couple of more places that you might be able to locate some relevant research information, some databases, or some full text articles that you might not otherwise have access to. So I also wanted to stress again before we move on that the webinar is being recorded and that all the slides are available. And they are available for download out of your GoToWebinar platform and will be later. So I wanted to make sure as we move into the next section of information that everybody feels good and can sit back and listen and absorb and not worry about writing everything down at this point. So next we're going to take a look at some of the ways to have the information come to you. And Janet, you're going to go ahead and continue with some of these push services.
Be happy to.
Great. Next slide, right?
Yes.
Yeah.
So the first thing I want to talk about in terms of pushing services is topic alerts. These are services that are available on the World Wide Web. So the three that we have here listed, Evidence Updates, Essential Evidence Plus, and Best Bets, are considered the top premier topic alerts products. Now there are other databases that do topic alerts such as Pedro and Trip, and you can check those out, and they will send, but these three scan the entire medical literature and then send you, they pre-digest what is of relevance to a variety of different topics, and then you have, when you register with these organizations, you let them know what your area of interest is. You can tell them what your patient population is, and you can tell them the things that are of most interest to you. Are you interested in internal medicine or public health? Is pain something that of a specific interest to you? Then they will identify the latest articles in your areas of interest and send you those citations along with the abstracts. So these will come directly to you in your inbox, in your email inbox. Evidence Updates, the one that's being pictured here, is run by McMaster's University, which is probably the premier evidence-based school in North America. So you can really trust the level of attention and evidence that you're receiving from these topic alerts. Next slide. So the other thing, and Jane had mentioned this earlier, is the table of contents alerts. Now, one thing that we do know is that many of these products, including PubMed, are very focused on allopathic medicine. So if you're interested in more integrative topics, you might need to go directly to the publisher or the journal specific site and sign up for their table of content alerts. And now this one, the Marianne Liebert journals, you can sign up at the publisher site for a variety of table of contents coming to you. And so these will be the journals that are not being indexed or reviewed by either the McMaster's organization or the National Center for Biomedical Information. So that is, okay. Next slide, please. Now, if your inbox is getting cluttered with all of these different table of contents, there is a way to resolve that. And using really simple syndication, RSS, is an excellent method for keeping stuff out of your inbox and sent to what's known as a feed reader. And this means that you have a site. I use Feedly. Feedly is a feed reader, and it uses the protocol, the web protocol, to send you new stuff from wherever you've subscribed to. This is more simple than it sounds. You download a feed reader or you sign on to a feed reader, and then you start subscribing to a variety of different sites. Many journals will support really simple syndication, so anything new that comes onto their website will automatically get sent to your feed reader. Now, I use Feedly as my home page. Every morning I turn on my computer, there's Feedly, and anything new that has come onto the web, onto over 125 different websites that I'm interested in, I see what's new in a very abbreviated format. Now, what I can do and what I have done is you can create folders. So I don't have to look at everything all at once. I can decide what I want to look at that day or in that moment. This is a very easy way to organize yourself, and it really reduces the amount of time that you spend surfing the web from site to site to site. I really encourage you to look into RSS feed. It's a well-known protocol that's been around for quite a while, and I think you'll find it worth your time to investigate really simple syndication. Next slide. So this is the Western States LibGuide, and we have some more information about pushing services. And this is open to the public, so anybody can go onto our website, and you would look for the button on our library page that says Guides and Tutorials. And you can find lots of good information there, and it's available to everyone. And many of these pages have been designed specifically for field doctors. So.
Great. Thanks so much, Janet. That's a great overview. And if you could back up one slide, Jennifer, I just want to point out in the PDF version of your slides, that link at the bottom is active, and it'll take you directly to what you see in the slide there. And I also did want to point out, and I believe that Feedly is a free resource. Is that correct, Janet?
I'm sorry, what was?
Feedly, is that a?
Oh, yes. I'm sorry. Yes, Feedly is free. The other thing, and thank you for reminding me about Feedly, I did want to mention that Feedly is a web-based product, and you should not assume any privacy whatsoever. I believe that Google watches Feedly very carefully. So if you are sending if you are subscribing to websites through your Feedly product or any other web-based feed reader, you should not assume privacy.
Thank you. Thanks for clarifying that. And there's also some other feed readers, and I think you guys have covered this as well on your LibGuide on terms of that you can pay for services, and it'll be a little bit more private.
Yes.
But the one that you noted is free, so we're talking about keeping our costs down and freely available resources. So. Lots of great information, and again, I did want to reiterate, there is a lot of information, and this is a nice section in terms of getting information coming to you instead of having to search for it. So again, as Jane mentioned early on, having a strategy that's unique to you is really important, and so maybe picking out one of these that you weren't familiar with and exploring those more fully might be worth your while. So Jennifer, next slide. And I did want to mention while we were in this portion of having push services is using social media to your advantage. And we'll come back to this in the information management section as well, but this is another form of pushing information to you. You can join or follow groups that have similar interests, follow journals or even a research center, and then this will all appear into your social media feed. That's one more way to get the information passed to you. So next slide. So hopefully at this point we've alleviated some of the frustration that you might have trying to keep pace with the literature. And next slide. Change that into instilling a little bit more confidence in staying ahead of what could be a tidal wave of information. And next slide. We're going to go ahead and switch our gears and talk about managing the mountain of information that you just collected. So from here, we're going to pass it back on over to Jane about keeping all of these resources organized once you find them all. So,
okay, thanks.
Thanks.
So we've seen so far many highly functional information management tools that are freely available, but I want to emphasize that no one of them does it all. So the system, your keeping up system, is going to work best if it has a mix of tools. So they can include some that you've just seen, and now I want to just briefly mention a few more. And FYI, what I consider to be one of the very best comes last. So next slide. Specialized search engines. We looked at PubMed's MyNCBI, setting up a personal account, and other databases often let you set up personal accounts as well. Trip, if you're not using it, is a great tool. It's a medical search engine, and it lets you specify areas of interest and will send a monthly summary of new research in your area of research if you have a personal account. For example, I receive their updates on complementary and integrative medicine. Trip also has a PICO search feature that lets you plug in the elements of the PICO formula, and then search for it, which is handy in structuring searches, in particular clinical searches. And Google Scholar, which I must say was a bit controversial when it first appeared to the library world. We were skeptical for a while, but I think that there is pretty universal consensus that it is a useful research tool for sure. It's especially useful for cutting edge or little researched topics. And setting up a personal account lets you save citations that you're interested in, and you can also receive alerts like in Trip. Next slide. Note taking and archiving resources. These may or may not be handy for you. They're primarily used for creating and managing what we hope would be HIPAA-compliant clinical notes. For example, our students here use it for clinical notes, but they're regarding therapies and don't include any patient information. These services also allow you to save clips from websites. And a couple examples are Microsoft's OneNote and Evernote. So maybe that would be helpful to some. But next slide. This is our Strategy 7 page, going back to the Keeping Up Guide where we started out. And Strategy 7 is Manage Your Research. So now we come to what I would consider the big kid on the block. That is citation and PDF organizing tools. I must say that a surprising number of people still store their PDF articles in folders on their computers, and there are definitely better ways. For example, Mendeley and Zotero are two free information management tools, and I'm going to talk about Mendeley now. At Bastyr, we require that students download Mendeley and at least try out its major features. So basically, what you do is you download the free Mendeley program to your computer, and then it also has a web version, and you sync your accumulating Mendeley PDF library with the web version. This means that the articles you've saved, your library of articles, are available to you virtually anywhere there's an internet connection. And so you don't need to take your computer somewhere. There's an app for smartphones, or any computer with an internet connection is going to get you to those articles. Mendeley, like your desktop, lets you set up folders to organize your articles. It also allows you to highlight sections of a particular article that catch your eye and annotate them. That is, add your own notes so that when you go back in months or a year and you read that article, your notes that what you were thinking about the first time around, those are part of the article, and you can revisit your thoughts then. Mendeley also has a feature that lets you easily cite research articles in various style formats such as MLA and APA. And getting back to what Deb mentioned earlier, Mendeley has a social networking component. So this lets you join particular groups that have been formed on topics of interest. It lets you share studies that you've found, and you can also explore various research studies that others from all around the world have posted. So I just think it's really an excellent tool ultimately to have in place. And on this Strategy 7 page of our Keeping Up with Clinical Research guide, there is a link on the right, circled in red here on the slide, to the Mendeley Toolkit. The Mendeley Toolkit is a whole guide in itself. But I don't want you to think that it's really time-consuming to set up your Mendeley account. It just isn't. But the Mendeley Toolkit has various troubleshooting. It also has strategies for getting it set up right so that you don't really need to maintain a copy of the PDF articles that you are accumulating on your hard drive. Mendeley keeps them for you. So that's my plug for a really excellent free resource for managing those PDFs. Deb?
That is great, Jane. Before we head to the summing up slide, I do want to mention that if anybody has any questions, please feel free to type those in the question box on your platform, and we're going to get to those here in just a minute. And I just wanted to summarize and expand upon a little bit about this tool such as Mendeley. First of all, being a free resource is wonderful, but the benefit that you mentioned of a web-based information management system, I think even can help in terms of moving research into practice, because your research is now mobile, not being stuck on your desktop at home, but you will have access to that through a variety of devices. So I think this is a really great tool, and hopefully everybody will get a chance to go on and check out the toolkit. Again, that link is in your PDF file, and it's active. It's on the bottom there if you wanted to go straight to what you see on the screen here. So again, if you have any questions, please feel free to type those in. I wanted to sum up today, and we'll move on to the next slide. Yeah, summing up some of the top time-saving tools that we covered. Jane had covered the My NCBI account and how this can really help you keep abreast of new information based on your specific search interests. And Janet also covered the evidence updates as one method to get the most current evidence pushed directly to you. And then more importantly, a great time-saving tip that Janet had covered is the RSS feeds and Feedly, and the value of these and keeping your inbox from being too cluttered, and to help you organize a little bit better. And along with organization, Jane then covered the Mendeley as a tool that can help you keep all this information in one place. So I did also want to make a small statement that, I know we've covered a lot of resources today. We've gone through this fairly quickly, but to encourage you to start small and to start with maybe one thing that might be new to you today and explore that a little bit more fully. And also going time right back into Jane's opening statements there that with the evolution of evidence-based, evidence-informed practice and evidence-informed care, keeping up is really a necessity as we move forward, and keeping abreast of new developments in your particular field will really impact your patient care, and not to leave that patient out of this whole equation here. So again, I'll open that up to any questions, and if either Jane or Janet had anything else you wanted to add, we'll go to the next slide. I want to thank you both for all of your time today, and I also want to thank the library staff both at Bastyr University and the University of Western States. We've had some wonderful collaboration at bringing this all together for everybody today. So thank you both, and feel free to add if you have any other comments that I didn't quite cover.
It was a pleasure.
Yeah, it was a pleasure too.
Great. Well, I think we still have another number of people on the line, but I still see no questions coming in today. So I think we've covered a lot very thoroughly today, and I'm sure there's a lot of information for everybody to sort through. But maybe Jane and Janet, if you can, what you think would be the number one place to maybe get a start on, from today. What would be like the number one tool that you might try to go to?
Can I go first, Janet?
Absolutely.
So I think what I would recommend is begin using Mendeley, because getting a handle on your PDF articles, which we all accumulate, is very, very helpful. Second, if you're not familiar with basic search features in PubMed, before going to my NCBI, I would definitely explore those using PubMed links on the main PubMed home screen. PubMed PubMed has really been stepping it up in terms of coverage of research, and as we all know, sometimes there are actually pretty good studies that get developed and conducted in the areas of complementary and integrative medicine, which, there's still a lot of what I would consider to be wasted research money on badly designed studies, but there are increasing numbers of good ones and increasing numbers of journals that pertain to the complementary and integrative fields that are indexed in PubMed. It's still, an allopathic database, but it is increasingly useful. It does have a lot of free full text. The National Library of Medicine tries to serve everybody. So I do recommend becoming proficient with PubMed because it's free.
Absolutely.
Wonderful.
The other thing that I would like to add, this is Janet, is that you utilize the skills of librarians. Talk to them, whether you're in an academic library or a public library. They live to answer your questions and want to help you, and you should consider them helpful pathfinders. They want to be of service to you, and they want to help you get to the best stuff you can. And so don't be shy. They really are there to help.
Yeah, I sometimes hear, I'm sorry to have to ask this question, but it's like, no, we love that. We love questions.
We certainly do.
So bring on the questions, in other words.
That's right.
Ask.
Speaking of questions, we did have a couple questions come in, and my colleague Beth is on the line. If you wanted to maybe read those off for us, that'd be great.
Sure. Hi. First is the question, are the free resources available to Canadian citizens as well?
Yes.
Yes.
Yep.
Okay.
Wonderful.
Very good. Then there was a couple of other questions here. The questioner can't remember if you said that Lonesome Doc is available via public library.
No. Lonesome Doc is a system where you would need to identify an academic, typically a medical library, that would be able to send you articles. You sign up through the National Library of Medicine. On the PubMed site, there are links to Lonesome Doc. You sign up as an individual practitioner, and then, but before you do sign up, you probably need to identify the library that you're going to ask to send you the articles. Does that make sense?
How do they do that, Janet?
Well, I basically, what you might want to do is call your alma mater first. In your local medical school, the closest medical school, and find out if they support Lonesome Doc and how do they do it. So if you're an alumni, be sure and identify yourself as one, because they're going to definitely be more, well, they're definitely will probably have a policy about support to alumni. If you are just approaching a school, they should have a policy to let you know how they handle requests from non-alumni but local practitioners.
Great. Thank you. One thing I do want to mention is, I wasn't really as familiar when we were putting this together with the Lonesome Doc program, and so I went in there and just and did a little search about which libraries are participating within my area. And that's how I came across the University of Maryland Health Sciences Library, which is only, 20 miles away or so. But if I wanted to spend a day in there, I could then go in as, as a member of the public and utilize their resources as a patron while I was in that library setting. So it might be another way to locate some libraries that you might not know are somewhere within your geographic vicinity as well. So Beth, do we have any other questions?
We sure do. There was a comment made about clinical record keeping, and the questioner missed the very first part of that comment. So
Okay, so that was me. Jane, I had mentioned the note-taking services that are available. And for example, Evernote and basically the note-taking, Janet brought this up yesterday when I was talking to her, that in the clinical environment, you would want to be careful about keeping clinical notes in Evernote or Microsoft's OneNote, for example, because of HIPAA. So it really is only, these resources are really only appropriate for general clinical information, for example, quick notes on the fly, web clipping if there's a website and you want to save it. But it's a very important thing to be aware of HIPAA regulations, so you can't use it for patient data. Does that answer the questioner's question?
I think it does. We'll find out if the questioner has another one, pop it on, but let's move on to this next one. This person has access to some academic databases. They teach at a community college and can search them like EBSCO using search terms, and they bring up articles of interest. However, often I have the title of an article and the author, but not the name of the journal they're in. Or they may have the name of the journal, but what they want is the full text copy of the article, and they don't know the database that the article is indexed in. How do you search for that particular article?
Do you want to take that, Jenna?
Sure. I mean, there's a couple of different ways. In the EBSCO databases, there is often in the upper band on the website, the ribbon at the top, there'll be something called citation matcher, and this is also a feature that's available in PubMed. So when you enter some of that information, it'll find the citation, and then that should bring up all of the information that you're looking for. Now, what the problem with finding getting to the full text is that not all databases have complete full text across all of the journals that they index, and so indexing and full text are different stories. They may index 300 journals and have the full text to 50 of those. Now, the community college that this person is searching from may have additional subscriptions, and they may link to those. So it sort of depends on how well the linking is, and they may need to go to a subscription list to find the journal. This is where the instantaneousness of the web is not so instantaneous. This is where you have to kind of uncover things a little bit at a time. It beats the card catalog system, but it still takes a little bit of maneuvering sometimes. And for help with that, sometimes it's good to talk to the librarian, and then they can show you how things are linked together. Once again, go back to that person whose job it is to get you the information.
Thank you. Thank you for that. There's a few resources and links that were posted in the chat question area, so we can take a look at those afterwards. And I'm just taking a look. I think that's it. That's all that I see posted.
Wonderful. Well, thanks everybody for joining us today. This was a great overview of a whole host of resources that are freely, well, some of them are freely available, most of them are. So hopefully everybody has walked away with at least one new tool to check out today. And if you have any questions, I'm always available on email. Feel free to contact me at dhale@acac.org. And again, you will all receive a link once this recording is available on our website, and we'll go from there. So thanks again, everybody, for joining us today, and have a great day.